Good afternoon. Thank you to everyone for being here with us today. We look forward to giving you an update on the COVID-19 situation in Mississippi. Since I was last with each of you on Friday morning, I have had an excellent trip down to the south part of our state. We had the acting Secretary of the Department of Homeland Security, Chad Wolf, come to Mississippi Friday afternoon, toured the area via air, and then also spent about an hour on the ground. Had the opportunity to speak to many Mississippians that got knocked down, some of whom lost loved ones, and I was very proud of the spirit of the people that we spoke with, and I sincerely appreciate the partnership of the federal government, of FEMA, of President Trump's administration, in helping us recover from those Easter storms. And I will get back to that and recognize Director Michelle really soon. As a reminder to everyone on where we find ourselves today, on Monday, April the 20th, we did extend our shelter-in-place order for 1 week. It is now set to expire on Monday, April the 27th. We were able to reopen some small businesses for safe sales, whereas people have the opportunity to go online or make a phone call to these small businesses, and they can, through curbside delivery service, produce those goods for Mississippians. It's one small step towards getting people back to work. In addition to that, we were able to open some of the recreational facilities for our people where it was safe, things like fishing and other items on the reservoir, as well as the beaches, as long as the local governmental entities allowed for it, and as long as we had adequate law enforcement to make sure that we didn't allow for large groups to be gathering. We have to maintain social distancing in those areas, but people have to be able to get out of their house and enjoy themselves as long as they can do it in a way that is safe both for themselves and for their fellow Mississippians. I do want to remind everyone that I do know how important it is that we get our economy open again. We have made small initial steps to do that. As I have said repeatedly, we went into this shelter-in-place order in a methodical way to ensure that we maintain the safety of Mississippians, but also did minimal economic damage, if at all possible. But we also recognize that over the last 3 weeks, we've had approximately between 130 and 140,000 Mississippians file for unemployment insurance. That is an unacceptable position to be in. Many of those individuals have never been on unemployment in their life. Many of them are scared, not only for their health because of the virus, they're also scared because of their economic health and the plight that they find themselves in many, many, many instances to no fault of their own. We recognize that, and we're working to build a plan and a long-term strategy to get our economy moving again. Earlier today, we had a meeting with Vice President Pence, the coronavirus task force. Virtually every governor across the nation participated, and the primary focus of that conversation was around testing. There has been a significant amount of talk around testing. It's interesting through this pandemic. For weeks and weeks, the only conversation that was had was how many ventilators do you have and how many ICU beds do you have? Well, it appears to me that at least to this point in the cycle, and from the standpoint of the United States, it seems very, very clear that the peak has come and gone, and while there are still significantly new number of cases across the country, we are seeing significantly less new cases on a day-over-day basis as a country. If you look at the mapping and the modeling that has been conveyed to us in terms of where the United States is today compared to where Italy was at a similar time, we not only have reached that peak, we also were able to keep that peak at a lower level if you look at it from the perspective of relative to the population size, and that's something that I think we as a nation should be proud of. Now in Mississippi, we've got more work to do. We know that, and we're monitoring it very, very closely. But with respect to testing, the conversation in the country has moved from ICU beds and ventilator availability to how much testing availability do we have. And I think that's important. And I think testing is something that we've got to continue to ramp up, and it's something that we as a state are having conversations around doing just that. But what I want you as Mississippians to know, and I have said this to Dr. Dobbs repeatedly, and I've said it in private, and I will say it in public, he and his team have done wonders as it relates to testing. We haven't tested as many people as we want, and we have continued to prioritize those in the healthcare space, those who have symptoms, etc. But keep in mind that in Mississippi, we've done over 51,000 tests, which what that means is that we have done more testing than almost any other state that has not gotten overwhelming federal support and overwhelming federal resources. For instance, the state of Oregon has about 1 million more people than Mississippi, and publicly available data suggests that we've done at least 10,000 more tests than have they. The state of Kentucky has about 2 million more people than Mississippi, and publicly available data suggests that we've done about 20,000 more tests than them. The state of Wisconsin has double our population, and we've done more tests than they have. The state of Virginia has triple our population, and we've done approximately the same number of tests. We are very nearing the position of having done 18,000 tests per 1 million population. And in large part, as I have said time after time again from this very position, in many instances, the number of active cases that one has, and particularly the number of new cases that one has from state to state, is a function of how many tests you are doing. We made the decision early on that we wanted to test to our maximum capacity. We're very fortunate in our state that we had scientists at the University of Southern Mississippi, that we had researchers at the University of Mississippi Medical Center. We had very capable individuals at the State Health Department lab, and they all stepped up. And because of that, we have been able to do significantly more testing than many other states, and that is a real success story for Mississippians in this particular crisis. And I want to personally thank Dr. Dobbs and his team and everyone that has been engaged and involved in that process. That doesn't mean that we're testing enough people. It doesn't mean that we do not want to continue to build capacity. Particularly with these high throughput machines, we can do significantly more testing and we can get results back very, very quickly. We are working very hard to make that a reality. We've got more work to do. We had a long conversation about that on our call earlier today, and I want to make sure that we continue to expand our testing capacity, our testing capability, and more importantly even expand the number of tests that we can get back very quickly, because that's going to be critically important as we move into the next phases of recovery. I particularly want to thank our healthcare workers, the men and women who have been on the front line of this particular battle. I know it has been tough. I have heard from many of you that are working long hours and are absolutely dedicated to protecting the people of Mississippi, and I want to personally thank you very, very much. We are doing everything in our power to continue to ensure that we have adequate numbers of PPE. We had a week last week in which we were able to ascertain large quantities of PPE. We've also had some help from the federal government sending PPE directly out to our Tier 1 facilities, particularly our hospitals and our nursing home facilities. We're going to continue to do that. I'm going to continue to ask you, if you are in one of those Tier 1 facilities, continue to be attempting to buy PPE on the open market. That is critical. And I will tell you that many of you in large hospital systems have more leverage when it comes to PPE than I do, because what the suppliers in the marketplace understand is 6 months from now, you're going to still be buying PPE. Hopefully, I am not as a state. Now, we're going to build up our stockpile. We're going to be prepared if there was another wave in the fall, which is what many people have said may be the case. But please continue to supply yourself, and we will continue to fill in the gaps if and when necessary. We do believe that contact tracing is extremely important piece of the overall puzzle. We have built teams at the Department of Health who are doing tremendous work. We want to continue to add to them. There is some speculation that the CDC is going to send out teams as well to all 50 states. We don't know if that's true or not, but we certainly believe that's a possibility, which will simply add capacity and add capabilities for our already extremely engaged and extremely talented team at the Department of Health. Our team has done tremendous work to make sure that all the cases are investigated and that those that need to be isolated and those who need to be quarantined are in fact isolated and quarantined so as to slow the spread of the virus. As we look at our data in Mississippi, it is very clear that our curve is flattening. For instance, on April the 8th, we had 210 patients in the ICU. Today, we have 146. The day before, we had 128 patients on ventilators. Today, we have 89. It's a consistent trend. But what we're seeing in Mississippi, unlike the state of New York, and quite frankly, unlike what you see in our nation's curve, due in large part because of the state of New York, they saw a very high peak, which is turned over. In Mississippi, through adequate management, what we have seen is a peak that's not nearly as high or nearly as steep, but it's also probably a plateau more so than a steep peak. And so that's why you're continuing to see more increases in cases and the number of cases on a daily basis basically being, if you average it out over a 3-day rolling period, relatively flat. But that plateau is at a level where our healthcare system is not stretched. It is not in a position in which we are having to turn away patients, and we will have, hopefully, when all is said and done, protected the integrity of our healthcare system, ensuring that we meet our goal. And our goal has always been every single Mississippian that needs access to quality care to recover and can recover gets that quality care, and to date, that has been the case. But because but I also do want to point out that is in terms of our whole state. We must remain vigilant because we know that it's still possible that we may have outbreaks in vulnerable populations such as our nursing homes and other long-term care facilities. We're watching that very, very closely. And also, we know that when the numbers are at a level, as I mentioned earlier, where we have 89 current patients on ventilators, an increase of 10 or 15 or 20 individuals across the state could lead to a fairly significant increase in percentage of patients, and that could be done in one building or one healthcare facility. And so we've got to continue to remain very, very vigilant. But we are confident, as I said late last week, and becoming even more confident, that our healthcare system is not going to be overwhelmed. We're looking ahead to what next week may look like if these positive trends continue. As we move into what we're looking at over the next couple of weeks, we are very hopeful that we can move more and more towards opening up more and more areas, whether that's geographic regions, counties, or statewide in particular industries. More and more of our economy must continue to open up. But we also must understand that if and when we lift the shelter-in-place order, that is not going to be a return to normal as normal existed several months ago. We are going to continue to require social distancing. We're going to continue to ensure that we do not have groups of more than 10 gathering and assembling for social purposes. We're not going to allow large groups to gather on the beach or otherwise. We're going to move into a prolonged period of moving back towards a normal posture, but nothing like where we were just 2 months ago. It's going to take time, but I'm confident that our people will do what you've been doing for the last several weeks, and that is the most important thing you can do, which is to use common sense. And so, as we look to the future, we recognize that we must give our people the ability to fend for themselves. We can't make it illegal to work and provide for your family, not in this country and certainly not in Mississippi. Now, I want to give you a little bit of a background on where we find ourselves. As many of you know, we did have very difficult weather in Mississippi yesterday. We did have, we believe, at least 2 tornadoes hit the ground in our state. The largest and the one carrying the most significant amounts of damage actually started in the Sandy Hook community down in Marion County, just on the county line with Walthall. So we have damage in Walthall and Marion and Lamar, and perhaps some damage in Forest County as well. We are doing damage assessments on exactly what that looks like as we speak. The National Weather Service is continuing to review the damage that occurred during the Easter Sunday tornadoes. I received a report just earlier today before walking in here, and of the nearly 15 tornadoes that occurred on Easter Sunday, it now appears that 2 of those were EF0s, 7 of those were EF1s, 3 of those were EF2s, 1 of those tornadoes was an EF3, and 2 of those 15 tornadoes were EF4s. The 2 EF4s, obviously the ones occurring basically from Bassfield to Soso, a little bit before Bassfield and a little bit after Soso in Jones County, but that's where a large percentage of the damage was done, one of which stayed on the ground for nearly 89 miles throughout our state. Significant damage done. The president on Thursday evening did declare an immediate emergency declaration for many of those counties that were affected, and it's critically important that we get damage assessments from those counties that have not yet been included by the federal government. So for those counties that were affected, of which there were many, if you haven't gotten that IA and PA declaration yet, the reason for that is we need damage assessments. We have to justify it as it relates to federal code and the Federal Stafford Act. Working together with our team at MEMA and your local emergency management directors, we want to help you gather that data, and we'll continue to work with you to make sure that we protect all of our citizens of Mississippi and get as much help to the people who need it as is humanly possible. So with that, I'm going to first turn it over to Director Michelle, who's going to give us an update on yesterday's storms as well as the damage from Easter Sunday.
Thank you, Governor. Just want to reiterate, the Governor's been very vocal about this, but just because the COVID pandemic is ongoing, it does not stop us and certainly does not stop Mother Nature. And I want to reiterate that April has historically been our most dangerous month of the year, and this month has started out rather as dangerous or more so than we thought that we would be seeing. So it's important that everyone pay attention to the weather throughout the remainder of this season. Of course, it seems like that in Mississippi it's seems like just a rollover of severe weather from one month to the next, but by all means, these April storms are much more severe than what we saw this time last year. So as the Governor mentioned, we did have severe weather last night, 2 tornadoes. We did have 1 fatality. That's going to bring the number of fatalities for Mississippi to 15 now, with that combined with the 14 deaths on the Easter storms. In addition to the damage that we had in the counties that Governor Reeves mentioned, we also had some minor damage in Hancock County and Smith County as well. So 5 counties there. What was unique about the tornado that we had last night as opposed to what we had on Easter is the enormity of rainfall that we had in addition to that. So in addition to tornado damage, wind damage, we also had a vast amount of flash flooding with this storm as well. So we will be looking at that. The Governor mentioned about completing damage assessments. I want to remind everyone that going back to the Easter storm, just because your county was not declared as a part of that declaration does not mean that they will not. Once damage estimates are completed, and if the appropriate thresholds are made for both IA and or PA declaration, then those counties can be added to that declaration. So again, just because you were not mentioned in the declaration does not mean that we cannot come back and add you later, and we certainly will if you meet those thresholds. Secondly, these 2 events, the event last night and the event from Easter Sunday, are 2 separate weather events, and that is based on law. So we cannot combine damages from the Easter storm to what we had last night. There'd be two separate events. We would do damage assessments, and if we meet the thresholds and they end up being two separate emergency federal declarations, then we certainly will make sure that that happens. Finally, I just want to reiterate that, that we want to continue to build capacity at our state level, and the governor said this before, that these events are state managed, locally executed, and federally funded. And just want to thank everyone. The outflow of support to these counties during this time, both last weekend and last night, were phenomenal, and I just want to commend the citizens for what they've done. Governor, thank you.
Thank you, Director Michelle, and let me just also reiterate something, because I think it's really important. As we talk about the counties that have been affected, in large part, that's where the most damage has been done, but in terms of counties that have been affected, they're much wider than that for a lot of reasons. One, you have damage in other counties, but you also have particularly those first responders from other communities that step up and go into those areas that have been most affected. And so we were talking last night about a particular county as we were looking at sending search and rescue assets when it looked like it was going to be necessary to do so. We had multiple counties ready to send their teams from other parts of the state into helping their fellow Mississippians. And so when we have major tornadic damage or we have major storms, as we have over in 2 of the last 8 days, every Mississippian is willing and wants to step up and help. And I just want to thank people from all across the state, all 82 counties, for your willingness to do what's best and to do what's right for your fellow citizens. We have a very generous state and a lot of people in Mississippi that want to help in these challenging times, and I want to personally thank every single one of you through this. With that, I'm going to turn it over to Dr. Dobbs, who is going to give us an update from the perspective of the Department of Health and what the health experts are seeing. Dr. Dobbs?
Yeah, thank you, Governor. So we're reporting today 238 new cases with 10 additional deaths, unfortunately. This brings us to a total of 169 deaths, 107 of whom are African American and 61% Caucasian. Our overall hospitalization rate has dropped slightly at 27.1%. We're still working on 77 distinct long-term care outbreaks, so a lot of work to do there. As far as testing goes, we've tested through this weekend 51,434 patients. Great thanks to the Public Health Lab, who've worked diligently to overcome every barrier and bottleneck that could be thrown at them, and also to our physicians and our private lab partners, who've really just done a Herculean task of getting tests done. So thank you, everyone in Mississippi and the healthcare system, for making that a success. As we look at kind of where we are and where we're going, we have been fortunate to meet some of our objectives. At this time, it does appear that the curve is significantly flattened in a way that we feel like is a successful endeavor. We also have not overstrained the healthcare system as far as like ventilator capacity, ICU and beds and that sort of thing. But I do want to make sure we don't go into a sense of complacency. I mean, we're still kind of in the meat of the plateau, right? So there's still a lot of cases going on. It certainly could rebound. We are very, very concerned about outbreaks in settings where people are close together. This could be in a situation such as a congregate setting, nursing home, so we're watching that very closely and trying to make sure that we respond to those aggressively and even more aggressively as we go into the coming weeks. But also to work environments where people are in close proximity to one another. It's very possible for outbreaks to occur, so we want to be very careful about that. Strongly encourage patience for everyone in the community, whether if you've been placed on a quarantine order or if you're a business that's having to face one of these things. We know how challenging it can be, but it's so very important, especially right now. This is not going to be this way forever, but right now, while we're still in the plateau of our peak, we need to make sure we don't let our guard down. So please exercise patience as we get through this part of our epidemic. And the only last thing I want to mention is just to really encourage folks to give blood. There's significant need within the healthcare system. That it's still a safe and advisable thing to do. And if you've had coronavirus and have recovered, please contact Mississippi Blood Services. They're trying to collect plasma that can be utilized for other people. So if you want to help your fellow Mississippians, other people across the country, and you've had coronavirus, please contact Mississippi Blood Services about donating plasma. Thank you, sir.
Thank you, Dr. Dobbs. And again, I want to reiterate what Dr. Dobbs said. We are in the middle of our plateau. This is the time to be even more vigilant. Again, stay smart, stay safe, and use common sense. Utilize social distancing. Make sure that if you're out in public and you can, wear a mask. Let's do the little things now for the next few days and weeks, and it can go a long way towards helping us help save our fellow Mississippians. Yes, sir.
I was going to follow up for some more detail on the plateau. Is it possible to guess, for lack of a better description, how long we could be at this plateau before we see a decline?
It's very difficult to speculate. We can hope, right, that over the next few weeks we'll start to see a decline, but it's dependent upon a lot of things. You know, what happens in areas where people have transmission? Do people change their behavior? Do people let their guard down? You know, big box stores are still pretty crowded. Makes me very nervous, and I'm not seeing a lot of folks wearing masks in the community necessarily. So, you know, please, hand hygiene, social distancing, wear masks when you're out in public and around folks. A lot of it depends on what we do collectively, and we can determine our own future.
Cornell?
I know that both of you referenced nursing homes. I saw that CMS yesterday and the administration had really strengthening some of the guidelines on reporting and things along those lines. Kind of a dual question here. Will those guidelines change anything about reporting or what we're seeing coming from the Department of Health at the state level? And then is there a consideration to release number of cases and deaths? Since we know that an outbreak, only one case constitutes an outbreak, is there consideration of providing some more details on the nursing homes?
Yes, there'll be more information forthcoming. There's enough volume of data that no individual person's identity is likely to be released. So you will be seeing information published in that regard very, very soon. I would expect even tomorrow, putting my team on under a little pressure there to get it out. But you know, we've been pretty aggressive with nursing homes and doing regular contacts and guidance. And so for us, we don't anticipate much change regarding the CMS guidance.
Yeah, and I would just say that with respect to more information coming out, I think we can probably all admit that the information that we're getting on a daily basis today compared to where it was 2 and 3 weeks ago, far superior to many other localities and superior to where we were even. And so I commend Dr. Dobbs and his team as we gathered more data and had more cases and therefore better analysis. It has provided for significantly more information to be provided to the public. And I think in times such as these where people are scared, they're scared for their health, they're scared for their economic well-being, the more data and the more information that we can provide, the better. And so we've been working closely with the department to encourage them to do that, and they have been 100% on board all the way. So.
How important is it for those families that have been kind of wondering if it's their facility or what's happening?
You know, and that, quite frankly, is one of the most difficult things about COVID-19 is to protect those individuals within the nursing home. We had to cut off visitation to the nursing home so as to keep individuals who may have it, symptomatic or otherwise, from coming into the home and bringing the virus. Well, by cutting that off because it was the right thing to do, you just put so many family members in a position in which they are very, very concerned because they're not able to actually get in and physically see their loved one. And in some instances, and I would presume in a lot of instances, they're not able to communicate with them either because the loved one is at an advanced age or in an advanced position in which that's just simply not that easy. And so that's been one of the more complicating things, is why you're trying to protect public health by keeping the virus out of nursing homes. You're also keeping families from being able to check on their loved ones, and that's just not something that makes sense to anyone. But I do believe it's the right thing to do. We're also looking at ways and taking best practices from other states to ensure that we are trying to find ways in which to continue to exacerbate cleaning and things such as that at our nursing home facilities. And Dr. Dobbs, did you want to hit on that at all, or just the question in general?
Yeah, we are, and we're trying to see more and more what we can do about helping with cleaning, putting teams together, doing more aggressive in testing around different cases, although we've been doing a lot of that already. It is sort of an evolutionary and a building process. As we sort of move from one stage to the next, we want to add more and more, and we can sharpen more focus as we build our teams and as we learn more to really make sure we pay adequate attention to places like long-term care settings where we know they're especially vulnerable, not only because of their age and medical conditions, but because of their close living quarters.
You've touted the state's testing, but at this point, those who want to test still aren't able to do so if they don't fit specific categories. At what point will whoever want to test can do so and get a test? Secondly, whose responsibility is it to test here in Mississippi, and does the federal government own any responsibility to help the state?
Yeah, so, at what point will we be in a situation in which every single Mississippian can just walk in and get a test? I don't know the answer to that. I don't know that we will ever have enough flu tests such that every Mississippian, asymptomatic or otherwise, would be able to get the millions of tests every single day, even if it were for the common flu. Our testing capacity as a nation is improving. It is improving at a rate slower than any of us would like for it to improve. But I will tell you that when you look at the number of tests that are being done in the U.S. today compared to just 2 or 3 weeks ago, it is up hundreds-fold. And so as more and more folks in the private sector come into the business of testing and we learn more and more best practices, I think that we will continue to see more and more testing available. One of the roadblocks and one of the challenges that we've all faced with respect to testing, which we have overcome in such a way that we've been able to increase it significantly, but not to the level where we'd want it to be, is the amount of swabs and reagents and other things that are available in the marketplace but not readily available as quickly as we would like. And so I think when you talk about who has responsibility for testing, I don't think it's an either-or question. It's a both-and question. I think working together with the federal government, the state government, and the private sector and private labs, which are playing a significant role in our testing. I think now, correct me if I'm wrong, Dr. Dowds, but approximately 75% of the total 51,000 tests so far have been performed by private labs. There is more capacity in private labs, and so we're continuing to work to make that a reality. And so I don't know that anybody's going to be able to give you a specific date as to when anybody who wants a test can get a test, but I'm not sure why anyone would want a test if they don't have any symptoms. We do have to do a better job of identifying those who have it and those who have had it. There was a study that came out earlier this weekend, and I'm not speaking to the validity of it, and I certainly haven't peer-reviewed it, and if I had, I wouldn't have the credentials to do so. But it suggested in one county in California as many as 50 to 80 times more people had coronavirus than actually tested positive for it. And so, again, I think as we move along over the weeks and months to come, the combination not only of the traditional testing that we're doing now, plus the immediate testing results that you get from, say, the Abbott tests that are out in the marketplace, and we're trying to get more and more of those, plus the antibody tests, over the next several months we'll have a much better picture of really the extent to which the virus has affected individuals and the extent to which we can monitor what may be a virus that comes back in the fall and again next spring. And we don't know the answers to that right now, but we've got to certainly be prepared for it.
Dave Elliott from WLOX has a question.
Great.
Governor?
Dave?
Governor, can you hear me?
I can, Dave. Go ahead.
Okay. As you know, the beach has been a hot topic of conversation in the 3 coastal counties. Harrison County actually opened on Friday. Jackson County will wait another week in step with your extension to the 27th. Hancock County today decided to stay closed an additional 2 weeks through May 4th. Are you okay with counties making these decisions on their own, or would you prefer a more uniform approach? And specifically, what do you think about Hancock County's decision, primarily because of its proximity to Louisiana and New Orleans?
Yeah, thank you, Dave. That's a great question, and I will tell you I'm perfectly content with Hancock and Harrison and Jackson counties all making different decisions. As I talked to the various individuals and the local elected officials in the 3 coastal counties, I told them exactly that. They need to determine what their resources are available and what resources they may need from the state, if they need any, to help monitor. The thing that we did is we said the state is no longer going to not allow you to open the beaches if you think it's safe for your individuals to do it, if you can monitor it. Because remember, even though we reopened the beaches, we still have guidelines in place statewide which say that no more than 10 people can gather in any one group, and that even those smaller than 10 must experience social distancing, such that they're staying at least 6+ feet apart. And for instance, the sheriff of Harrison County assured me that he had adequate manpower to make sure that they broke up any larger groups that got together. But it makes perfect sense that what's happening in Hancock County, particularly with their proximity to Louisiana, if they think that that is in the best interest of their citizens, they have my full support. The key here has always been, we're making decisions on a statewide basis that does not preclude local governments, county or city, from going a step further, for being a little more strict, as long as they don't do anything that is in direct conflict with the state orders that protect essential businesses and otherwise.
Patrick McGee from Sun Herald has a question. Patrick?
Yes, Governor. Notice that some school districts have been very cautious about moving forward with graduation ceremonies, but then again, you have places like Bay St. Louis where you have a graduation parade that's set up or potentially be set up to house family members. Then you have other districts that are doing simple drive-ups for graduation and small gatherings. I want to know your thoughts on this, and also, are there any guidelines that you think need to be set on this?
Yeah, well, what I would say about graduations is, honestly, and I think we need to look at it on a week-by-week basis. I don't think that next week anybody needs to have a graduation ceremony that brings in hundreds of people into a small facility and has a graduation. But I think there's also an argument that can be made that graduations don't have to happen in May. We could delay them until June or delay them until July, when perhaps that may be a more safe opportunity, depending on what the virus does during the summer months. I can't see into the future as to what July looks like. Many of these viruses, I am told, do have a hard time continuing to spread and operate during the heat of summer. But we don't know if that's going to be the case with COVID-19 or not. There's been a lot of things about this virus that have been unparalleled, and obviously it's been very contagious. And so, I think as if I were running a school district, and we've tried to give our school districts maximum flexibility, I would try to be patient. And if I wanted to do a graduation ceremony, I'd be looking at perhaps doing it online, and because we do not need large groups gathering and touching individuals, and that's the challenge with funerals and weddings. They're very emotional ceremonies, and graduations are the same. And in Mississippi, we like to hug each other. And when you have emotional ceremonies and emotional gatherings, even if you're trying to experience social distancing, a lot of times we screw that up and we're just not able to do it. And so that's why it's best not to have large groups coming together. So,
Emily from AP has a question. Emily?
Hi, Governor. I wanted to ask for an update on the latest in testing for coronavirus in the prison system. How widespread is that at this point, the testing?
I haven't gotten an update today on where we are with respect to specific tests in the system. I don't know if either one of you guys have gotten anything today on that.
I got an update over the weekend, but I don't have an exact number.
Okay.
Yeah.
Emily, we'll find that out and get you the answer later this afternoon.
Are there any known cases in the state of outbreaks at food processing plants? Some individuals, family members have contacted us saying that they believe that there might be. Who would be monitoring those, and would there be the potential that they could be closed, as we've seen some of those type facilities in other parts of the country?
Yeah, well, the Department of Health is monitoring monitoring every single case, and so they would be monitoring any potential outbreaks. within a food processing facility. Obviously, we all have to figure out exactly how we define outbreak, because I think in long-term care facilities, we still define outbreak as one patient testing positive. And so I'll let Dr. Dobbs speak to that.
We have numerous outbreaks across the state that we're monitoring in different type of businesses. Certainly we're not going to single out any specific business, but we do, we do isolation quarantine around those individuals as well. In large measure, although we don't know for certain yet, a lot of it seems like it's community-acquired cases. But then we have to be very vigilant once it does get into a place where there's a lot of folks. And that's why it's so important to be compliant with this isolation and quarantine piece, because we don't want it to spread within these facilities. But we'll continue to see outbreaks. I mean, we have 77 nursing home outbreaks. We're not going to have, where people gather, cases will spread. And that's why it's so very important for all the social distancing, hand hygiene, masks, people to stay home when they're sick. And we'll just continue to respond to them and continue to augment our capabilities.
Any further measures that would be taken if it were involving food processing specifically?
Are you worried about like contaminating the food or
Right.
something? Not especially the way that all the food is processed, and certainly USDA and FDA are involved to make sure the food is safe. So there's nothing that would be released that was not safe.
Yeah, and I would just remind everyone out there, if you are feeling symptomatic, if you don't feel well, if you have a high fever, stay at home. To all of our employers that can, much like we did coming into this room today, if you have the ability, and I've talked to many of our employers around Mississippi in essential businesses, and many of them are doing this, but if you have the ability to set up someone who can take temperatures as they come into the facility, things such as that go a long way towards ensuring that we don't have major outbreaks at our essential facilities. Yes, sir.
Dr. Dobbs, at what point will, as you collect data, will you do community testing and sampling?
I guess I'm not quite sure what you mean by community testing.
Well, as you know, not everyone is symptomatic. To get a better idea of the spread specifically for Mississippi, at what point will you go into do random sampling and testing?
Okay, I understand perfectly now. There's several things that we're going to do, and I would like to kind of go back to this. Everybody who wants a test gets a test. Everybody who wants a test doesn't need a test. Everybody who needs a test needs a test. And if we really wanted to make sure that no one had COVID, we would test every Mississippian every day for a month. Obviously, we don't have the capacity to do 90 million tests, right? Because if I'm negative today, I could easily be positive tomorrow or the next day or the next. So just randomly checking people for the virus with the nasal swab is not an effective way to use our resources whatsoever. But people who have symptoms definitely need to be checked. And we're looking into people who've been exposed may well need to be checked. So there's a different sort of tiering of the necessity of testing folks. And we're working to spread that out, absolutely. But as far as surveillance, we're already working on surveillance networks to try to find either cases that are actually showing up in the ER, like in the clinic, and do they have flu or something else like that, so we can understand the community burden. But we're also looking at options for serology, so we can see what the entire burden is on the state, so that we can better understand not only what's happened, but what we can predict for the future. But those plans are underway.
Alyssa from Clearing Ledger has a question. Alyssa?
Hi, Governor. Thank you so much for taking the time to do this. My question is, on Sunday, the Department of Health announced the largest single-day increase of coronavirus cases so far at 300 new cases verified that day. I was wondering if you could help explain how does that fit into the picture of the plateau?
Yeah, so as you've probably heard me talk about, and I'll give Dr. Dobbs the opportunity, a shot at this as well, but as you've heard me talk about, daily new cases is not a particularly good indicator of where we actually are in the curve. And the reason for that is because on any one day, you may have, for instance, a lab that is producing 3 or 4 or 5 or even 7 days of results, and they're reporting it to the State Department of Health on one day. And so what we really spend a lot of time looking at is once we get the cases in, the health department does a fantastic job of then reaching out and figuring out when the onset of symptoms occurred. Because that's really a better indicator of what's happening, and the real indicator of the curve more so than any one day's results on number of newly positive tests. So, Dr. Dobbs?
Yeah, that's a perfect explanation of what's happening. And also remember that we're getting results from a week ago. Someone gets sick, they're ill for a few days before they get tested, and then it might be a few days until we get the result. So what we're reporting out today reflects what happens a week ago, just in the natural cycle of things. And there is some natural sort of clumping of reporting. You've noticed a lot of variability day to day, and that's just sort of the nature of the beast. I would look at on our website the graph of cases by date of clinical onset, and I think that does give you a lot better idea of what our trends really are.
Yeah, and so in other words, take a 3-day rolling average or a 5-day rolling average will give you a better indicator. Because if you'll recall, there were 4 days last week where we had, and I don't remember the exact numbers, but basically 281 day, 281 day, 121 day, and 141 day. Well, that's not an indication of anything that's happening other than that's when the results came back. We weren't in significantly better shape the 2 days that we were at 120 and significantly worse days when we were at the 280 number. It's just, you got to take a rolling average. But I think the point is the cases by date of illness onset is really a better indicator of the curve actually flattening out more so than is just the day-to-day testing results that are reported on. They're reported on there that day. They're not actually, the virus is not contracted or derived from that day. So,
Dave Elliott from WLOX is another question.
excellent.
Dave?
Thanks, Governor. The casino industry, 21,000 employees, $722 million annual payroll. Just back in January, as an example, $13 million to the general fund, $7.2 million to local governments, and that includes schools. Yet I don't believe there's a representative of the gaming industry on your Restart Mississippi task force. First of all, why not? And what do you see for the casino industry moving forward?
Yeah, well, let me just first say that the Restart the Economy task force that we named last week was a starting point, not an ending point. We have had significant conversations and actually have received, I believe, some information from the casino industry, both individual casinos as well as the industry leaders as well. The casino industry is an industry that employs tens of thousands of Mississippians. It's critically important to our economy, and it's certainly critically important to the revenue streams, particularly of the local governments, Dave, as you well know, on the Mississippi Gulf Coast. And so as we look at that, and we're looking at ways in which to open those casinos in a responsible way. Obviously, it was the Gaming Commission that shut them down originally, and we're going to work with the Commission to find ways to allow for a safe reopening of those entities, just like they're trying to do in Las Vegas and other regions of the country where they are shut down. It's an industry that's really struggling, and honestly, there's literally tens of thousands of Mississippians that have filed unemployment insurance that were directly tied to that particular industry. And our heart goes out to those individuals, and we're going to look to continue to find ways to get that industry, as well as all industries, back open in Mississippi. Scott?
You got any projections on what type of financial hit the state has taken in this multi-week period as far as how far we're going to be off budget projections versus reality?
Yeah, I mean, I could give you a guess, but it would be nothing more than a guess. It's something that I'd like to see what April and May look like, and I think once we get through May, we'll have a better indicator of where we're going for this current fiscal year. The unfortunate thing in Mississippi is that in the last 3 months of the fiscal year, which is 25% of the fiscal year, obviously 1/4, in the last quarter, which would be the second quarter of 2020, we typically collect about 40% of our total revenue. And so from a timing standpoint, this is never a good time to have a 100-year pandemic. But in Mississippi, with the fiscal year being year-end June 30th, this is a particularly bad time from a fiscal standpoint for the state. So we anticipate significant reductions in revenues. That's the bad news. Good news is we came in the best financial shape we've ever been in. We're in the best fiscal shape we've ever been in. There are other states, and I've heard many governors, typically in blue states, that have spent a lot of time talking about the fact that their governments, particularly their state governments, got the chance of being bankrupt because of this. I don't think Mississippi's in that position. We may have to tighten our belt. We're used to doing that. But we are going to see significant revenue losses, just as Dave mentioned earlier. Just the revenue from the casinos is between 10 and $15 million a month. So if you just had 4 months of that, that'd be somewhere between $50 and $60 million in lost revenue to the state just from that one industry. Not to mention the 140,000 Mississippians that are out of work whose wages are no longer being received. So real challenging time financially, and that's why it is so critically important that as soon as it is safe that we get our economy back open again and get it back rolling. And that's why you are seeing me push very hard to look both from a geographic standpoint as well as from an industry standpoint on when we can get our workers back in the workplace in a safe environment.
Anita Lee from Sun Herald has a question. Anita?
Thank you. The question for Dr. Dobbs, and I'm wondering, I'm sure you saw the numbers from the Harvard Global Health Initiative on the need for 152 tests per day per 100,000 population. I'm wondering if you can tell us where Mississippi is in that regard with that statistics for apples to apples comparisons, and where would you be comfortable? And when Governor Reeves talks about it being safe to reopen, what number of tests per 100,000 would you be comfortable with saying it's safe to begin reopening the state in a broad way?
Yeah, thank you. Great question. So recent publications comparing us with other states in the New York Times put us at 84 per 100,000, which was really pretty good in comparison, and that's where our number 6 in the nation rating comes from in that daily count. So, you know, we're partway there. We want to do a lot more. There have been significant bottlenecks, and as the governor mentioned, we've received really extremely little federal support in our testing capabilities, as a lot of other states have. Fortunately, we weren't a high priority. We don't want to be a high priority for federal support, so that's okay. But we certainly could. We could also use them, quit diverting our private resources to other areas. We've had a lot of diversion through this control tower model. Now, getting to when we can open, I mean, open is it's a binary word, but, you know, we're going to be in the social distancing sort of framework for a long time. It took us a long time to get up here. It's going to take us a long time to kind of get out of it. Governor's been very thoughtful in every step of the way and have appreciated the opportunity to have long, meaningful, deliberative conversations. Anything that happens will be very based on data. It'll be based on our local realities. Every place may not be the same, but you know, I don't think anybody's talking about a blanket reopening back to normal for a long time, and I think that's going to be the key.
Dave Elliott from WLX has another question. Dave? Dave?
Oh, 3 questions. Governor. Governor, a question for you. The $1.25 billion coming to the state of Mississippi from the Fed and the CARES Act with that stimulus does come with federal guidelines that mandate that money be spent specifically on COVID-related efforts. Does that fall in the executive lap? In other words, with you, does the legislature play a role in that? And what kinds of things do you think Mississippi needs most in regard to maximizing that money?
Well, thank you for the question, Dave. Just send a thank you note to Renee that she's operating the computer, because I would have limited you to only 2 questions. But no, in all seriousness, it's a great question. So the money in the CARES Act is very specific, that it is at the discretion of the governors. That's something that President Trump was very adamant about in his remarks. It is also specific in that it states that states cannot use that money to make up revenue losses, either for state or local governments. That was not the intent of the legislation from the Congress. I am hopeful that there is more conversation to come with respect to additional resources to be provided for state and local governments in perhaps either the next stimulus that they're talking about now or the one after that. I certainly hope that is the case. But in terms of what we can and cannot spend the money on, it provides for a lot of latitude for the governors. But what has been asked of the Treasury Department, this is a program that is overseen by the Secretary of the Treasury, Secretary Mnuchin, and we are anticipating sometime by Friday of this week, and could come as early as today, guidance from Treasury on allowable expenses in that particular program. We just don't have it yet. And so again, we were told sometime last week that it would come by Friday week, which would be April the 24th. And then there was some conversations earlier today on our call with the Vice President that it may come sooner than that. But as soon as we get that guidance from Treasury, we can have a real in-depth conversation on what is allowable and what is not allowable. What I hope to be able to do is to utilize those resources to help Mississippians, to help our people that are struggling mightily right now, and also to help our small businesses get moving again, to help with workforce development and workforce training, to ensure that we can adapt to the jobs post-pandemic, because the jobs that were in our economy a month or two ago very well may not be the jobs that we're going to be trying to expand upon a month or two from now. And so, but again, until we get the guidance from Secretary Mnuchin and the Department of Treasury, it's just not a question I can answer yet.
Anita Lee from Sun Herald has another question.
Great.
Anita?
Yes, Dr. Dobbs, thank you for your earlier answer, and I just wanted to know if you could tell me where you would like to get to test-wise per day per 100,000. Where would you like to see that number be?
Even different than a number, it's a where and how fast. I think if we could, basically double our capacity, that would be wonderful. But we would do so well if we could have uninterrupted supply chain and then access to rapid tests. All the rapid tests have been effectively diverted to other parts of the country. And so if we could go have an outbreak and go in the same day and test everybody and have a result that afternoon, that's what we need. A lot of it's the what and not the how many. But if we could essentially double our volume and have that sort of flexibility, not having to wait a couple of days for a result, even that couple of days is a delay that makes it hard to be as reactive as we want to be. Anyway, just, it's hard to know how many, but I would just say if we could double it and do it faster, that'd be awesome.
Well, thank you all for being here today. It appears that's the last question that we have. I am going to, as promised, wish a few good Mississippians a happy birthday. Starting with Heather Reese in Biloxi. Happy 18th birthday to Haley Davis, who is a senior at Stone High School. Happy birthday, Henry Stewart and Zach Moak over in Raymond. Happy birthday from Joe Perry, who just graduated from Air Force basic training and now is in tech school. Mason Cummings loves to fish, and Huck Kennedy is turning 2 today. Reed Whitlock and Tad Deere is also turning 2. Happy birthday, Bailey Wells. Happy birthday, Sarah Rogers of Soso. Happy birthday to Siler Scott Self, who's turning 14. Hannah in Ocean Springs, and Connie Garwin. Happy birthday to Abby Wedgeworth in Petal, and Wyatt Speck in New Albany. To Sam Tucker Golf, and Lane Rose, and Levi Runnels, and Brendan Hamburg. I am told from your teacher that Kenteria Gordon is a hard-working student, and your teacher wants you to know happy birthday from her and happy birthday from the governor. Happy birthday to Josie Rose, who is turning 7. Happy first birthday to Paxton Reed Houston. Happy birthday, Presley Town, and Michaela Krim. Michaela is a straight-A student at Pass Christian High School. Happy Sweet 16 to Allie Hurd, and happy birthday to Beth Newsom, who loves gardening. Happy birthday to Stagger Lee Sanford and Chase Cunningham and Sadie Ellis and Presley Roberts. And happy 13th to Lizzie Bernathy. And happy 10th to Brooks Newton. Happy birthday to Drake Corson, who loves school and riding his bike with his brother. Happy number 5 to Hunter Likens. Happy number 3 to Harper Skeen. Happy number 10 to Deuce Ring. Happy Sweet 16 to Peyton Coleman, who cannot wait to get his driver's license. Happy birthday also to Mecca James, who is turning 90. I'm told that Miss James is a beautiful woman inside and out, and at the ripe young age of 90 is still spunky. Happy birthday, Miss James. Happy birthday to Gracie Galt, who's turning 13. She plays the flute in the South Jones High School Band. Happy birthday to Jemiah Jackson and Dayton Trey Boyette. Happy number 4 to Noah Emmanuel Cook. Happy birthday to Levi Myers, who loves police cars, fire trucks, and construction equipment. Happy birthday to Jack Goff and Austin Wade and Jessica Long and Paxton Strong and Daniel Farah. Happy Sweet 16 to Sarah Copeland. Happy birthday to Michaela Mallet, to Cruz Sims, to Vicki Hankins in Nettleton, to Aliyah Collins, Erica Luster, Elena Zetterholm, Naomi Bolin. Happy birthday, Bobby Anderson over in Vicksburg. Happy birthday to Britley in Grenada, who is turning 9. To Sheba Borden, happy birthday. And also happy birthday to Patricia Wiltshire, who is a wonderful mother, mother-in-law, and grandmother. Happy birthday, Patricia. And then finally, I'd like to wish a happy birthday to someone who is turning 88 years young in the Mississippi Veterans Home in Kosciuszko, Mississippi. Happy birthday to Henry Halford. Happy birthday, Henry. Thank you for your service, and God bless Mississippi. Thank you all.